To help you out with today?
Teresa Dobar receives home care every week. At 80 years old with 2 hip replacements, she needs a nurse to help her out.
I'm very happy with them because they done so much for me. And if it was not for them, I wouldn't be able to stay in my house.
She hired a private company 2 years ago for $60 a week. The public home care system is maxed out. To alleviate pressure from the ER's emergency operating centers have been discharging elderly patients and following up with them at home instead. Companies like Nurse Next Door have been picking up the slack.
We really have seen an increase, especially in the last 3 or 4 months.
And they're expecting business to boom. The new health status report says since 1995, we've seen a 60% increase in the 85 and older population. And we've seen a 50% increase in the 45 to 55 age bracket. Right now in Regina hospitals, 33 elderly patients are waiting for long-term care beds.
Certainly, as our population grows, it's going to put a lot of pressure on the system.
The region has already been planning for the aging population, but they say these statistics do help motivate action for more home care funding. They even took a meeting this morning with Nurse Next Door to discuss working together. Van Norman says he sees their job as keeping the elderly out of hospitals and long-term care homes, where depression rates are higher than people who are able to receive care in the comfort of their own kitchens.
We found that when people have a service like ours, falls are prevented, nutrition is increased, and their return to the hospital is far less likely.
How's your meal, Teresa?
Very good, thank you.
Teresa dreads the day she has to move. She's much happier here in the house she's lived in for 21 years.
I'm independent and I have my grandchildren coming and some living out of town. They could stay here on the weekend.
She says with the range of services home care can provide, she can stay where she is much longer. But for people who can't afford to pay a private company, this may be only possible with future public health funding. Whitney Stinson, Global News.